Hello, this is Dr. Do again. This video is still on alphabetic list of problems. I'm still on letter P. Today I'm going to talk about a concept. Actually, some of them still used in clinics. Some of them was already became a historical term. It's called pre-disease condition. For example, pre-diabetic and pre-hypertension, which is not used currently, but used to be a concept, a very serious condition for the clinician to educate patient. But nowadays, this concept is not used anymore. But anyway, I think, based on some of the literatures. But anyway, the pre-disease condition, so of course there's no emergency because this is really the concept of preventive. And can you manage at home? Definitely. That's the major significance or the meaning of this pre-disease condition. If you do your work, if you do exercise, decrease stress, eating healthy, those conditions can turn around, reversible without medical intervention. So that's really what I mean by talking about this pre-disease condition. Of course, some of them, if you realize, if you're ready to battle it, then the physician will help you. If you did the exercise, you did a healthy diet, but because the stress level is still high in your life, you cannot battle it by yourself, then physician will help you with some medications, but the outcome is way better than the disease condition. So I'm thinking about probably 3 or 4 of them. Major is metabolic. Probably nobody call it a pre-metabolic syndrome, but I probably think it's like, for example, the pre-hypertension before the real hypertension. When I talk about this pre-disease condition, it's based on the value, the numbers, or the conditions. It's between the optimal and the disease, between the normal and the disease, the optimal of normal. So the range is between the optimal normal and the disease values. For example, the hypertension, about 140/90, systolic 140 and diastolic 90, and the optimal is 120 and 80. So the number between of this 120 to 140 and 80 to 90, this period of time is quite critical actually. That's called, like I said, it's not called pre-disease condition, but there's a space. That's the turning point. You can reverse it back to normal without any going further to the hypertension, or you just go straight to the hypertension. The same idea for the diabetes. In between this 120 or 126 or 100 or 110. So this is the number we're looking at if you have this kind of test. Or symptomatically you fall into the range, but fall into the you have the symptoms, but you do not have the number. So that's also, I think it's a time to alert you to do the right thing, to make it correct, and to prevent it progress to the disease. So that's what I mean. I give you an example, including the obesity and overweight. So the BMI, if BMI about 30, between 25 to 35, actually between 25 to 30 BMI. So this is the time. About 30 is called obesity. About 25 is called overweight. So the overweight stage is the optimal stage. I mean, it's the best time for you to think, to take serious action on this. Do not make it further going beyond 30. So this is the pre-disease condition I'm talking about. Of course, this obesity and overweight is the easiest thing to do, or the not difficult to manage if you really are ready for it. But if your BMI above 30, then probably sometimes, even though about 25, in some conditions, some individuals still need medical help. but majority of them can. Just if you're ready and if you modify your lifestyle, and you in your mind you have the right mindset. So I'm determined. I'm not going to let my BMI going further, at least to maintain or decrease it. If that's the time, if that's what your mindset is, and it's the time, then you can do it without medical intervention. So you can do it. A lot of time, if the BMI above 30 or 35, above 35 probably need a surgical, and above 30, I think sometimes really need a medical intervention, need a medication to help, because we all have you're busy, you're under stress. Even though you cut off your calorie intake and you eating healthy, but still sometimes it's difficult to manage as a real condition. So the same idea for the hypertension. Before the hypertension, before the number 140/90 and above 120/80. So this, if your blood pressure fall in this range, at least you need to have the mindset. Do not let it go in upper, higher. So by living a healthy lifestyle, exercise, losing weight, and eating healthy, and decrease stress. So this is the fundamental lifestyle modification can really change the consequence, the outcome. And the same idea as the diabetes. If you in that your blood glucose is not that high, but you're craving for the sugars and you eat more, and you feel like you're always thirsty, or about 100 or 110. So if that's the case, really need to give yourself a signal, or about 120. It's close, just a number 126. You're just really close to the diabetic. So if that's the case, really you need to talk to your physician, and at the same time you do what you need to do to the same idea as the hypertension lifestyle modification. See whether it can maintain this blood glucose still under that 126. If you cannot, you need to talk to your physician. If you're willing, you talk to your physician. Even though my blood glucose is not 126 yet, but I want to maintain this, or if you have family history, talk to your physician. Your physician might give you some advice, or start with some medication to maintain this goal. Otherwise, probably, since you have, particularly for those have a family history, so really need to talk to your physician. The lifestyle modification, first of all, how to do this, the mindset is the first thing. You're ready to do this, you take serious. If I don't do this, things getting worse. So that's the good start point, the only start point, actually. If you're not ready, then there's nothing anybody else can do. So that's your mindset. And then the reality, how is your life, and also talk to your physician. I think that the best way to do is really talk to your physician. Even though without medical intervention, your physician tell you you need to do lifestyle modification, you will listen. So to help you get ready, help you to have a right mindset to slow the progress of the condition and maintain normal range. Even though not optimal, but at least it's not going to the direction of diseased condition. So this is about the video. It's very quite fundamental, but it seems very trifle small, but I think it's important. So I'm going to stop here today and hope it helps. And thank you for watching. I will see you next time.